This couple of days, I watch a lot of the video and learn about the condition of ENS, especially from the YouTube, and learn some people post the video and about how the ENS affected the life. So far, one of the main symptom and the feel trouble disturbed is the dryness. It's kind of like extremely dryness on the nose, and sometimes the clogging on the nose. So there'll be further disturb the breathing, and also even one gentleman is actually his name. Website name is the peppermint. He was mentioned about the dry of the lung. So basically, when you breathe in, you took out the moisture from your lung. So constantly moisture loss from the lung and from the nose make very difficult, especially at night. So that will disturbing the sleeping. At night, he mentioned that when you're at night and your heart will pumping slower and then you kind of slow it down. But when it's slowing down, you don't have enough blood flow through the nose to kind of pre-moisture the air so that your lung have issue. So when your lung was lose moisture because your lung is directly blood and the air between a layer of the membrane, the exchange the air. So when the moisture will took out from the blood, actually your blood will supply the water to the lung. The lung must be 100% moist to work properly. And when the water was took out from the blood, you make your blood, I think, would be sicker if you cannot supply enough water in your body, and also your lung will be struggling to maintain 100% moisture if constantly lose moisture. So at all this situation, that will make a very difficulty for air transition. And he mentioned about a lot of the shallow breathing, so he cannot do a lot of the deep breathing, so it's very shallow. So when we shallow breathing, the lung is not go to a big capacity. So basically, our lung is only maybe half percentage or whatever. So in that situation, we don't have a large surface area. We don't have the potential for the oxygen transition. So with all of this situation put it up, so lack of the oxygen can be hurting all our organs. Mentioned about kidney disease, and can be hurting out there, and also lose moisture, also the hurting that. And but the key things is moisture losing. For the regular person, through the night we usually lose some moisture. That's why I suggest at early morning you will drink a cup of water to compensate the water losing. And for ENS, because our breathing air channel is so open, so basically when we breathing out, the air cannot stay into the air paths for longer. So that when we breathe out, the air just leave very quickly. Breathe in very quickly. So